everyone, it is such a pleasure to see you again for another MassMEDIC virtual town hall. I'm Rachel Robinson, Vice President at MassMEDIC, and I have to say this is our last town hall of 2021, which is somewhat bittersweet. I don't know about the rest of you, but I don't exactly know where 2021 went. It's been a whirlwind of, if you've been keeping up with us, virtual programming and a lot of in-person stuff for some of you, which is great. It's kind of wonderful to see the world opening back up again, at least for a brief moment. Hopefully we can keep it open as long as possible. But I just want to say a quick thank you and a shout out to everybody who's been joining us for this program. I did a quick overview of some of the numbers before I hopped on here, and we've had 11 town halls this year, over 1,000 registrations, so 1,000 people joined us live for this program. We had over 25 speakers. I've put a list of our sponsors here on the board because we could not do this without A, all of you attending, and B, our wonderful partners and sponsors, because they allow us to provide this awesome content free of charge for you. So I wanted to take a quick moment to shout out the groups that have been so supportive this year: MPR Product Development, Boston Analytical, Toxicon, Weidman, who you're going to get to know a little bit more about today, the Mullings Group, who is amazing and will be speaking with us as well, Greenlight Guru, QAD, and RQM Plus. They are just fantastic supporters of all that we do, and we couldn't do what we do without them. So thank you to all of them for supporting this program the entire year. It's been a blast to have this one going. So we do have a really great program today. It's a full program, but we've left lots of time for Q&A because we really want to spend some time talking about trends from 2021 and what to expect for 2022. Before we do that, just a few quick housekeeping notes. As always, we love Q&A. The Q&A option in the bottom of your screen is the best place to pop questions in. You can also send them in the chat, but sometimes they get lost as more come in. So I recommend Q&A for sure. And we absolutely want to hear from you. So please pop those in. Just another few quick things to remember. We do have an upcoming slate of programming for the next 2 weeks. It's actually very full. We've got a program next week on outsiders joining MedTech. So we're going to have a conversation with Kohler and Best Buy Health to talk about what it's like for consumer companies to jump into the health tech space. So you won't want to miss that one. And then we also have our December FDA program coming up on December 8th. We will be joined by Annie Saha from the Digital Health Center of Excellence at FDA. So she's going to be doing a keynote all about what the Digital Health Center of Excellence is placing their priority and focus on for 2022. So you definitely won't want to miss that. So I think without further ado, I will turn things over to Dan Hanlon at Weidman. So Weidman is one of our newer members and sponsors. And we asked him to give a real quick kind of hello from Weidman and let you know what they do and why they're excited to join our community.
Thank you, Rachel. We're just going to call up we got a quick presentation. There we go. So Weidman is a fourth generation family owned company. Our CEO is Francisca Chudi. We are located our headquarters are in Rapperswil, Switzerland, and we also have another facility there in Bad Ragaz, as well as a facility in Saltillo, Mexico. Just quickly at a glance, the Weidman Group, our turnover is $370 million. This is 2020 numbers, 370 million. We are a full service contract manufacturer, and our market focus, as you can see, we're 65% medical device, IVD, and 35% pharma. We have 80 molding machines and 38 fully automated assembly and packaging lines. Our global footprint, as you can see, again, headquartered in Switzerland, US, North American facility in Saltillo, Mexico, close to the border near Monterrey. We also, as you can see, the blue dots are our Weidman Group facilities, where we would have the opportunity either within our own healthcare facilities or within the Weidman Group facilities to expand our footprint as our business expands. We have ISO class 5, 7, and 8 clean room to offer. And I think, as you can see, we pretty much, I think we check all the boxes in terms of the certifications that are required for servicing the markets that we participate in. Just some quick product overview, give you a sense of the vast array of types of programs and projects that we support with our customers. The patch pump highlights high precision micro molding and molding with some pretty challenging materials such as PEEK. The fast click device, a couple of quick notes there. It's a highly complex molds, 64 cavities, and we're doing over molding of needles to the tune of 1.5 billion per year on a 30 gauge needle. So it's pretty precise operation. And in our in vitro diagnostic and pharma research, again, you can see a variety of programs that we support. The point of care is of interest, as we know today, is becoming a big part of the marketplace where in-home use of medical devices is growing significantly. So we see great opportunities there. And then in the pharma drug delivery and tissue engineering, we have RFID capability. And again, you can see a variety of products that we produce that are, again, fairly technical in nature. And so with Weidman, and again, we understand these are buzzwords. So when we have the opportunity to speak with prospective customers, we certainly would go into greater detail about some of the things that we've accomplished and that in the partnerships that we've generated within our customer base. I think some of the key points relative to our business is that we're a privately held company. We're very nimble. We have the backing again of a major corporation at 370 million in revenue, and yet we're a very lean organization in terms of the number of people you need to get to a decision within our organization. So, and I'm joined today by our Director of Sales, Ben Diedeker from Switzerland, and as well as our sales engineer, Lucas Peter, is here joining us from Switzerland as well. In the US, I serve as the US Key Account Manager, and my colleague, Joe Ruxtashill, is also here in the US. I'm located in Massachusetts, and Joe is located in Connecticut. So we have, I think, a pretty tight product offering and service offering in the sense that we have the Swiss headquarters where, a really strong engineering team there, coupled with a very experienced and highly educated group in Saltillo that's extremely customer focused. And again, we have both commercial and technical support here in the US to facilitate, whether it's supporting our US based customers or, again, obviously prospective customers. That's our quick and dirty 5-minute Weidman introduction. We certainly welcome any questions, and we certainly would look forward to being able to engage with any of the folks joining this meeting today. Again, you see our contact information. I believe, Rachel, our presentation will be uploaded so people can access it.
Absolutely. So when we send out the video of this program, we'll make sure to include that for you.
Perfect. Thank you very much.
Thanks, Dan. Well, before we kick into programming, I did want to give Brian Johnson, our fearless leader and president, a chance to say his own kind of thanks and wrap up for the year. So, Brian, I'm going to turn this over to you.
Thanks, Rachel. Thanks, Dan. Thanks to the Weidman team for your support. Rachel alluded to it, MassMEDIC is a member-supported organization. And closing out 2021, we have now gone, 22 months without a in-person live event that where we actually I don't know the timeline, but I know that we haven't sold many tickets in a long time. So your member dues, your sponsorships, your support is critical to helping us produce programming. And I think the key to why we're successful is the passion of our members and the passion of folks like Dan, the team at Weidman, Holly, and the team at Mullings Group, and the team over at PwC, and all you guys on the call. We have a shared passion of making this industry cluster, this ecosystem, as sharing the energy and that we feel every day, and bringing excellence out is evident, and it drives us every day. But I want to just specifically call out Rachel Robinson for her work on these virtual programs. She's done an incredible job on our team driving these. She's our fearless leader in many ways, and I just want to thank you for all the work you've done. It's been incredible, and it's my pleasure to work with you guys and the team here at MassMEDIC with Kayla and Rachel and David and Helen and all the other folks that make this place run. We're sending out our renewal letters. I've been starting to send them out over the past couple of weeks and kind of taking stock of what we've achieved in 2021. It's pretty incredible. She said we have over 1,000 registrants. This is just one of our virtual programming. We've produced, I think, maybe 90 hours or 80 hours. I can't remember. I lost track of original free content for the medtech industry. This is done by a very small team. At the same time as we've done a ton of work in terms of the advocacy and the business relationships and all the one-on-one stuff we do, we love it, and there's a lot more to come. This is a perfect table setter today, because as we move in 2022, MassMEDIC and is really focused on workforce development. We got to make sure that the jobs and the opportunities that are here are met with we meet the moment with the workers that we need. So we're very focused on that as we go into 2022. We're going to be bringing back some really fun programs that we held in person. I'm really excited by that. I love seeing you guys. And, we're going to continue to grow, and we're going to continue to try and push the envelope when it comes to content. I thank you, Rachel, for the opportunity to say a little something. We're very grateful to be working with all you guys, our members, and we don't take any of it for granted. And we put every ounce of our energy into making this community vibrant. So more to come.
Here. Thanks, Bri. Okay, so we've got an awesome program, as I said. So I would like to take this moment to introduce Holly Scott from the Mullings Group. So obviously, workforce development, hiring challenges are something that, as Brian said, we are very critically focused on, especially in the medtech industry. Over the last, 6 to 9 months, things have rapidly changed, and we're expecting an even crazier, hopefully settling at some point 2022. But Holly, I would love to hear from you what you're seeing and what your thoughts are.
Sure. Thank you. And thank you, Rachel and Brian, for everything, for putting this together. It's been a great year. To give you some context, I've been with the firm now, it'll be 24, 25 years in February. I've lost count, just having so much fun. We focus in search within medtech, and predominantly, especially with the numbers of the last 2 years, health tech. The reason being is most of our business from an executive search perspective is building young companies. So when I speak to the trends that I see, keep in mind that we are following investor market and sentiment there, investor funding and market sentiment. And that tends to be what drives our decisions and what drives our clients' decisions around hiring. So with that said, I'll share a presentation here. I do want to move pretty fast through this because I want to give some padding to an opportunity to ask questions. So I will do this now, and just let me know if I'm too fast or if it's okay. Can you see my screen, first of all?
Make it bigger with the green circle.
There we go. We're in? Okay, great.
Looks great.
So trends to watch. Okay. So as mentioned, we follow the money. That's our primary driver for building young companies is we follow the money. And since the pandemic hit in 2020, we have never seen in my career, and Joe Mullings, my partner's career, has been in it longer than I, we have never seen investment into healthcare as we have. And it's driven hiring and to an all-time high. So where there's interest, there's money. Where there's money, there's interest. So staying close to that when it comes to hiring and career trends is really, really important. We're seeing a big drive in terms of hiring associated with technology and value-based healthcare. If I were to say that's one of the primary reasons that young companies are funded in the last 12 to 18 months, it's driven to the idea of value-based healthcare, putting data behind clinical decisions, behind payer decisions, reimbursement decisions. That's become very, very interesting. So organizations that are building around that model tend to have or are hot right now. There's a lot going on. Infectious disease that we've all heard much about over the last year or so is still in the limelight, although I'll say that some of the waning from COVID and treatment, we're seeing it subside, and that's only normal. Hospitals can only hold so much inventory, can only hold so many ventilators, PPE, and the like. So where there's an abundance there, we are seeing more funding going into preemptive solutions to infectious disease, whether that's earlier detection, earlier genetic makeup counseling in terms of determining who might be predispositioned to have a terrible case of COVID versus somebody else having the sniffles. There's some really interesting science going on there. So if the market is sizable enough and the technology has legs, the companies are getting funding. And what that means for hiring and trends there is there's a lot of opportunity where those investments intersect. Marketing in a digitally driven world. So this top-down has been a huge shift in the industry for both the companies that are looking to create awareness and attention of what they're trying to do, especially in what we call a candidate-driven marketplace right now. Candidates are in high demand. It's also become an opportunity for the candidates to create more awareness and attention around themselves and creating their own individual brand. They also, for the first time, have the opportunity to interact directly with target companies and target employers, which is creating a wealth of opportunity for the individual when it comes to marketing themselves and for the company to market themselves. So that's become really exciting, and it's creating a lot of interesting vehicles for individuals when it comes to hiring for their team, as well as courting companies of interest. Work from anywhere, the famous tagline of the year, right? That's not going away, and what we are seeing now is a bifurcation between those who are on the boat and those who are not, and that's going to carry into 2022 as a real line of demarcation. The employers who are open to it and embracing the benefits are getting higher retention. The employees don't necessarily want to work remotely, they want the choice. And what we're seeing is those who are being heavy-handed or coerced, or they're just not on board with it. So it's not, again, about going to work, it's about not having the choice. So empowering the individual and empowering the employer to come to a balance that works well is winning. And that's what we're seeing as a big trend as we move into 2022. I would say most of our calls have some context about expected time in the office versus not. So that's a big trend that we expect to carry over into next year and beyond. Education, there's been a lot of excitement, I believe, around education, because all of us likely on the call and many of our children have gone on and are putting everything on college education. And we're seeing companies that are investing in education, from certifications or from aggressive courses or abbreviated courses, to allow individuals to meet demands of work today, which includes a high, fast-paced, absorption of technology, and technology isn't learned over 4 years in most circumstances. So there's a lot of creative avenues going in for educating the workforce and for continuing education that I believe will really continue to impact hiring trends. And you hit on something interesting, Rachel. I'm going to be sure to make that meeting with your regulatory leader, because regulatory science in our industry, when we know what FDA cares about and where they're sitting, we know that there's going to be some interest, some wake when it comes to investors as well as technological entrepreneurs and people stepping up to meet those demands. And right now, the FDA has gone public on where their interests are. They're responding to infectious disease. They're looking to increase competition around innovation, which is healthy for all of us on the call, and maximizing the opportunity with data. You know, they created their own internal agency of sorts to address data, whether it be software as a medical device or software as a service incorporated into the data streams based on the heavy software demand. So these areas tend to drive where organizations receive the funding, and those funding decisions, again, in turn, need talent. So that's where we're seeing a lot of interest moving forward. Empowering the patient and empowering across the pendulum of clinical care, from patient to provider to clinician, all of that shared information is giving more information and insight into the patients themselves. So whether it's wearable technology or information that gives feedback, or telehealth and remote patient management, all of those areas are expected to continue, and actually in a more healthy and balanced way than in their early years, because sometimes the early entries of tech in these spaces cobble along as they're figuring it out, where right now there's more wide acceptance around wearables. Now it's clear what insights can we gain and where is this going to be valuable. So individuals who are staying close to career and where they're interested in going career-wise, staying close to wearables and staying close to data that's integrated between the patient and the clinician and the provider will provide many opportunities moving forward. Interesting. Supply chain, distribution, and logistics is one that is actually ripe for the uptake, and there's a lot going on there. Whether it's organ transplantation, you know, streamlining the process and communication, or moving products, services, goods, whatever it may be, those areas are huge for opportunity right now. We're seeing a lot of investment and a lot of trends going in that direction, which means companies are being built around supply chain logistics, specifically associated with medtech and health tech companies. And democratizing surgery. Look, this has been a word and a phrase we've been watching for years, but it's really, really neat to see companies that are able to augment surgical procedures, whether it's through robotics or better navigation tools or remote access to surgical procedures from different parts of the world, different parts of the country. These are areas that are really becoming, not only are they on the field, they're becoming best in class. So now that we're seeing lots of players, we're going to see streamline of who's the best player in these particular buckets. And those are creating a lot of opportunity for individuals, especially if you are interested in driving your career along those lines. Staying close to the trends in those areas and those companies that are doing well is very, very beneficial. So as we look at 2022, we expect investment in young companies with healthy opportunities in health tech to be the primary focus. Technology, software intelligence remains hot. The companies that are going to focus on the individuality and the relationship between the employer and the employee will win in retention. We've all come off of a very interesting time where many, many people were transitioning. We expect that to settle down a bit. However, there will be issues as we move forward for organizations that are not embracing the individuality and the needs of the person in their spot of productivity. And I'll also note that we're seeing a higher demand, and I'm seeing it especially at the C-suite and at the executive level. Hard and soft skills are critical, the experience and the aptitude, but we're seeing more than ever before individuals without specific experience being bet on higher because they have the right soft skills to engage and influence across the leadership team and across boards and such. So it's very, very interesting to see this dynamic, because it comes back to when we hire individuals, we hire based on what we believe they can do and not exclusively what they've done already. So it's creating a really interesting environment, and we'll continue to stay close to that, especially in the young companies. So trends to watch, overall, empowerment of the individual. So we are and expect to continue to be in a high demand environment for hiring for at least the foreseeable future. I do expect it to level out a bit, especially as the tech companies become more seasoned and they realize the challenges of adoption in the health environment. That might cause a little bit of a slowdown or a pullback, but in general, as we are in this marketplace, it's only going to create more opportunities for the individual, because the individual can own their job search in a much more pragmatic way. The personal connections are highly valued, and the old school black hole, I submitted my application and never heard anything. Well, that there's too many other tools now and too many other opportunities to get around that. So we're going to see a lot of branching out on the typical way of an individual finding and landing their next opportunity. So let me pause there. I know I blazed through it and I'm sensitive to time. Any questions, anything I can address or answer?
So we definitely are going to have questions, I'm sure. So everyone, feel free to pop them into the Q&A. I think, Holly, one of the things you just mentioned, especially, and someone put in the comments, was about CVS having a recent article that they're going to phase more out of retail and focus on healthcare services. So it's a really interesting, I think, trend to watch. And that's one of the reasons we're doing the program next week with Best Buy Health and Kohler. I mean, I think a lot of people don't know even yet that Kohler is getting into the healthcare space. I mean, that's a completely consumer focused company, toilets and kitchens and everything of that nature, kind of trying to move into home health. So I think it's a really interesting trend. What are you guys seeing from a hiring perspective? Do you think that folks getting into the traditional medtech space from outside are going to be trying to take potential employees from medtech companies to bring them over? Or do you think it's more of a tech play learning medtech?
Well, there's both, and this wouldn't be their first time doing it. I mean, we've watched Apple do it for many years. We've watched Amazon do it. There are tech companies that pick off med talent, bring them into the organization with ambitious goals of becoming a healthcare player, and 8 times out of 10, they squash it. And a lot of it comes down to the marketplace that they're looking to go after, the regulatory environment, the adoption curve, there's lots of reasons behind it, but it's a hard thing to swing. What is interesting, though, is the players now that you're seeing in it, they're not looking to become healthcare companies. They're in a better, like a Kohler, for instance, they're in a better position because they already have the customer base to design interesting technology to add to the portfolio that they already are adding. So if it's a subtle change with an incorporation of product or data or service that they can leverage from their existing experience, I think that's where we're going to see more wins. And frankly, the regulatory and environment is much more open than it ever has been for data and integration there and services. So I think we're better positioned to see some of these companies do well.
Awesome. So let's look at this from the company's perspective, because we've got 2 different questions about companies and candidates. So from a company perspective, what do you think the key mistakes they're making in kind of the hiring process right now? Obviously, the work from home is probably one of them. Are there any other kind of key moments where you're just kind of banging your head against a wall saying, okay, you got to let that one go?
From the company's perspective, I want to make sure I heard that correctly.
Yes. Yes. You
So
think
the-
companies are doing anything that's just kind of not lining up?
Well, I think the companies in general, we have to reframe the applicant tracking system process. You know, at this time and where we're at, you know, 2021 moving into 2022, it's insulting to have someone submit an application and have zero follow-up and have zero, you know, feedback, and even the automated emails. It's just that whole space is really ripe for upheaval. So the organizations that are taking a more proactive and individualized approach to hiring and to selection, just like individuals are doing in the marketplace with targeting companies and people that they're interested in, the more internal effort that is owning a process and an actual search rec and having more of that high touch for individuals in process, they're going to see reciprocal value, not only with that hire, but the ripple that creates in the experience, because only one person's hired and 30 people are touched through the process. So all 29 go out and have good things to say. So if I had any, you know, one piece of advice to a company, I would say, look, take the recs that you have and take each one like it's a CEO search. You know, if it's a software engineer, if it's a product manager, you know, how are we going to go about this? What kind of care and white glove service can we wrap around this experience that will allow the individual to feel important, feel valued, and for it to be streamlined? Because those are, right now, we are in a highly competitive market. And when a candidate is called on 5 different opportunities and they have a bad experience with 1 or 2, you know, it does send a negative wake. It really does. So that would be my thought there.
Great. That actually plays into one of the next questions that we don't now need to ask, because it was about the submissions black hole. The only comment I would make is, you know, we've seen that actually happen. I had a young student actually reach out recently saying she had a hard time finding a company in medtech who would hire her while she was still in school, but she didn't have a co-op program at her school, but could do 20 hours a week. You know, she said there were no job listings. I advised her to give our members a call. So I got her an interview with one of our members who responded immediately. And then when I reached out and talked to her, she said, oh, great, I called 2 more of your members and they've agreed to interview me too. So how can people really nail down the right person to call? Is this someone where they should just be calling the HR manager? Like, any tips on how to do that?
Well, it's usually the person that you can add the most value to. So let's say on this call that our primary audience or director of VP individuals, if I'm a VP of reimbursement, I'm going to want to talk to a chief commercialization officer or someone who understands the value that I could potentially bring. And forget the application process. Go direct to them and give them value. So Rachel, look, I'm reaching out to you. I know we haven't had the opportunity to chat. I'm a specialist in reimbursement. I understand your product has recently recently come out of early feasibility. You're starting to think about a scalable prototype. I'd love to chat with you a little bit about how we can best tee up your organization for reimbursement success moving forward. And you know what? Chances are pretty high they'll take the call. And that's all you need. You need somebody who will get on the phone with you and understand that you're not a black and white piece of paper or a digital representation. You're real and you're adding value, and give of yourself until somebody will pay you for it. Okay, that give all you can. If Rachel is the CEO of a company and I'm a head of reimbursement and I give her some ideas and she hangs up and says, wow, that was a pretty interesting exchange, she may not be able to hire me tomorrow, but I guarantee you she will refer me then to Bob or to Sally or to whomever who also has a similar situation. So in a lot of ways, our world is going back to where we came from. With the influx of digital information coming at all of us 24/7, We are now in a mode of being hyper selective of what we pay attention to. So you need to be at the forefront of where the attention, what they care about. And HR, they're not paid to care about you. Okay, they're only paid to deal with the person that is screaming at them that they need that hire made. But the head of marketing might really care about you. The head of R&D might really care about you. The director of software engineering. So those are the people where you're going to reach out directly. And everyone who is in job search mode in every company that is in team search mode is in sales. And the sooner we get our head around that, the better the results will be.
Holly, this is great. So we do have a bunch more questions in the Q&A, but we probably don't have time to get to them live. So I want to jump on to the rest of the programming. But I'm hoping maybe you could hop in the Q&A and just type in a few answers for folks. That would be
Happy
really
to.
Great. Thank
Sure,
you, Holly.
Thank you.
Always wonderful to have you, and very great presentation. Always good trends. So thank you again.
Oh, good. You're very welcome. Thanks for having me.
Of course. Okay, so we're going to switch gears a little bit. I've asked our good friends and partners at PwC actually to give us a little bit of update on medtech trends from 2021 and thoughts about 2022. So Dave, Elena, Kevin, I am going to turn things over to you.
Great, Rachel. Thanks so much. And thanks to the MassMEDIC for having us. We're delighted to be with you all. Holly actually did a great job teeing up a lot of what we're seeing as well. So I think you'll pick up on some consistency here. And for all those looking for jobs, we do have a flexible work from home policy firm-wide. So, welcome. We welcome that interaction as well. So look, I'm Kevin McClellan, a partner in Boston here and one of the leaders in our MedTech practice. I'm joined by Dave Powell, fellow partner, and Elena Preto. And collectively, we serve, a broad swath of the industry, right? And so our perspectives here are informed from what we're seeing, from traditional device manufacturers, new entrants, as Holly referred to. And that, frankly, is an interesting space. We also see quite a bit of where the capital is going, right? And I think over the last couple of years, there's been real shifts there. Places like DME, which is, traditionally a little bit more of a sleepy category, has gotten quite a bit of investment. Certainly informed by the deal activity, right? And this past quarter, I think was about the third highest in the last 10 years for M&A activity in the space, right? So we're seeing a lot of that. We thought we would share just very brief perspectives with all of you. And similarly, we'll leave some time for Q&A. So I actually have just one slide to share here. Let me see if I can show that here. Bear with me. Okay. I will share my screen for lack of being able to figure out how to share a browser window. Oops. Okay. So we've kind of put some thinking together, and we'll actually be sharing a more comprehensive version of this shortly in the form of a publication, but we thought we would kind of preview a bit of this. We've been thinking a lot about, given all the changes, how do medtech companies really thrive, right? And it is an increasingly complex environment, but it's also one with lots of opportunities. And so as we've synthesized the big trends, right, we see a few things that are really shaping the industry. One is this notion of expanded care delivery, right? And a lot of this, of course, was pandemic triggered, but really accelerating a path that we've been on for quite a while. And the technology enabled care anywhere paradigm we think is really important, but not just for the patient doctor relationship. Really, I think this has also elevated the role of caregivers, right? You know, a lot of talk about how parents observed their kids in school. Well, you know, caregivers were very close to the people they were giving care to throughout the pandemic for obvious reasons. And that of course has increased the willingness, the appetite for care anywhere. And so we see that as not only a recent trend, but one that is pretty permanent. The second is around interconnected ecosystems, right? And I think, you know, a lot of this is driven by the desire to lower costs, to get better outcomes. We see things like employers who are spending a tremendous amount of money on healthcare starting to take matters into their own hands. Certainly the continuation of health systems, particularly those who are taking risk, trying to do more in the end-to-end patient journey. And so that is driving new relationships, new players. Somebody was mentioning CVS, right? That's a slightly different version of the same thing, which is, you know, they're following the money and figuring out the best use for their assets. But, you know, who thought CVS would be part of the clinical development process? And that's exactly what they're trying to do. So they've connected themselves into something that, you know, previously was quite separate. The third trend, and I think, you know, there's lots of versions of this, are really empowered health consumers, right? And empowered both in terms of the access to technology, right? You know, CGM is quite a incredible technology when deployed well. It's still relatively early in its deployment globally, but has the potential to change the game in lots of ways. We see things like micro EKGs. You know, I joke that I carry one in my briefcase. My wife got worried. I said, no, it's more just, you know, to understand what these things do and how they work. But it really does start to put care and outcomes in the hands of patients. And we think that that's an important trend, you know, which really started with more information, right? Things like WebMD allowed you to question your doctor, have more informed conversations, et cetera. That's really a long-term trend that has also been accelerated with the adoption of technology. And then finally, you know, tech-enabled innovation, and you guys had talked about Kohler, Best Buy, others. You know, these are companies that are coming in and solving problems that, at least in our view, our industry has not solved, right? And what they bring is less of a product-centric mentality and more of a data-first mentality, which is, you know, it's an aspect of what high-tech companies think about. And they are coming in trying to solve problems with modern technology, cloud-based systems, cloud-native systems, in a way that MedTech has frankly been slow to adopt, right? And so that's both an opportunity and a threat. And I think, you know, as was mentioned earlier, many of these companies are learning the hard way that it's not so easy to just jump into a regulated industry like ours. But you know, that's not gonna be a barrier forever. And folks are both hiring people, but also investing in building capabilities to get smart and to get capable in our environment. So you know, those are a few big trends. You know, we've got a perspective that there's really, you know, three emerging ways to play, right? So, you know, this is all going on. So what? There's kind of the first and more traditional way, which we call product mastery, right? Own the category. You know, could be you know, minimally invasive surgery, could be orthopedics or subcategories within orthopedics. Like, pick your category, but really own it and do it well, right? And plenty of companies are out there participating in the market and trying to do just that, right? And that's fine. MedTech's going to probably continue to grow mid, you know, single digits. Margins will continue to be attractive, albeit under pressure, but it's a perfectly reasonable way to play. One step beyond that, right, is what we're calling the product-driven service innovator, right? So, and this has been a challenge, but you see some spots in MedTech where this is starting to happen. You know, going beyond the product and solving bigger challenges across, a broader spectrum. And this could be things like robotics platforms that allow for more efficiency and actually help the surgeon in a bigger way than just the products. It could be things like linking post-acute care and tracking progress of patients. It could be, biologics that are complements to traditional products, et cetera. And we would say that there's good early examples here. It's hard to find somebody who's really, shifted their model entirely that way. I think if you looked at the equipment players over the years, they've shifted increasingly to services, right? So that's a more traditional example. And then finally, this platform-led innovator, right? So, can you fundamentally shift to what is more akin to a tech model? And we see some of the new entrants trying this, which is less product first and more product enabled service, right? And makes a bigger deal of trying to monetize data, trying to connect people, and trying to drive outcomes beyond just a product focused mentality, right? And this is still rare, but I think there's a lot of outside players trying to come in and drive this kind of change in the industry. And frankly, in our view, from the provider lens, they are looking for that kind of help, right? Which is maybe a bit of a risk for medtech players that have not decided which way they want to play, right? And so we offer these three as all valid options, right? We're not saying that one is any better than the other, but we are saying you need to be clear about how you're going to participate in the market, which may in fact be different than how you've traditionally participated, given the trends and how this will likely unfold over the next few years. So let me pause. Dave, Elena, welcome your additional thoughts, and then perhaps we open it up for Q&A.
Let's open up for Q&A from my perspective.
Yeah, I agree.
So we do have some Q&A coming in. I think the one that I have, if you don't mind me going first, because I like to steal the platform because I have questions.
I think you have that right, Rachel. Yeah.
So I'm loving the trends. The thing that concerns me, and not concerns, but just gives me a moment's pause, is I love the concept of empowering healthcare consumers to take more responsibility for their own health. What scares me is going back to the trend of WebMD, where everyone is self-diagnosing and thinks that they have cancer all the time, or someone gets a sniffle and they suddenly have COVID. So how do we responsibly empower and inform those kind of in our community? And any thoughts or anything you're seeing that's doing that they're doing very well?
Yeah, look, it's a great question. We live with this, my young adult children, right, come to me and say, oh my gosh, like, I think I have this, right? Because I Googled it and, I had checked all the boxes. And I think, look, in the near term, that's both a risk, but also perhaps just the stage of the journey. I think part of the way to help work through that is, and I've seen this, my primary care doctors at MGH, and not to pick on them or laud them, but it's very easy now to get a nurse practitioner, right, to answer these types of questions. But to do that, you kind of have to go through 3 phone menu levels and hit the button and wait, and then somebody might get paid. Like, can we not just make it easier to talk to clinicians, right? And sort of lower the barrier to those types of interactions. And it doesn't have to be somebody sitting down on Fruit Street in Boston, but somebody who can interpret and say, hey, look, even a triage call to say, you got to go get that checked or not. That would be a big step. Now there's lots sort of wrapped into that, and it's, easier said than done. But in some ways, I think better access to, clinicians, doesn't necessarily have to be a doctor, will certainly help that.
It's really great. I think education is so important, right? You can't just give people tools and expect them to know how to do everything that's expected with those tools and know how to analyze the results of those tools. So it really does come, I think, a lot, and it's a responsibility of the entire industry to make sure people really understand what's going on. So no major questions coming in. There are a couple comments, and one of the comments actually made me wonder if you've seen anything, kind of the holy grail of monitoring devices has always been clothing or fabric. I think we're seeing a little bit of that, but have you seen any trends kind of moving away from the watch? I mean, at this point, everybody wants to put a watch on you with something different. What do you think is going to happen with wearables?
Yeah, that's an interesting question. I mean, well, on the one hand, maybe you're moving away from watches and more towards clothing, but on the other hand, you have things like, CGM, which are arguably, way more invasive than a watch, right?
Yeah.
And so the at least one thought there is, how do you rely less on one thing, right? One device, and better connect the information you're getting through, probably multiple of these types of devices in the future. I'm not a deep expert on material science and so forth, but with your iPhone, right, and just that simple camera, well, it's not so simple anymore. There's tech out there that allow you to measure arterial or aortic stiffness, right? I mean, that's unbelievable. And so the question, I think, is quickly becoming less what can you measure and how do you measure it, but what do you do with that, right? How do you turn that into behavior change? How do you turn that into better outcomes? Those to me are the bigger questions, because we can measure lots. We can throw more data at clinicians. They won't be any more effective unless we can figure out how to get people, and this comes back a little bit to the empowered consumer, to do things differently for themselves, right?
Yeah, that's a really great point. I think you're absolutely right. It does come down to outcomes, right? And what you can do with that data. I remember hearing a story once from someone who was pitching the idea of a monitor in hospital where you could predict if someone was going to have a heart attack, and saying, oh, the clinicians are going to love this. And they talked to a clinician, they're like, what are we supposed to do with this? We just kind of have the paddles ready, like we're going to give the person a heart attack, waiting for them to have a heart attack. So you have to be able to actually actionably use that information to drive change and outcomes. So I think you're absolutely spot on with that. So I think that maybe, we do have one more question coming in, if you don't mind taking another 2 minutes.
Yeah, sure.
How can or should companies manage the risks around payment? Some of the innovations are shifting sites or stakeholders, but payments are usually tied to the incumbent process.
Yeah, I'll start, and maybe Dave Elena can add. I actually had a client who kind of went down the path while they were waiting for a new product to be reimbursed, and they had something pretty compelling, that they just went direct pay, right? And have had pretty good success with that. And for me, the reimbursement paradigm will shift a lot more slowly than perhaps coming up with compelling things that people are willing to pay for because it matters to them. So that doesn't fully answer the question, but that is at least an angle. You see what's happened with deregulation as well, right? Or what's coming with deregulation, things like hearing aids. That's going to make a big difference. And I think if we don't consider the impact of that on the market size, right? Like if you were in the hearing aid business, you looked at the market size, as being this big, it's about to get, potentially 10, 20x bigger. And so shifting the model, the business model accordingly is I think a relevant way to deal with at least part of that.
Well, we've got 2 more minutes. I want to make sure any of your other team, if you guys want to add anything, feel free to, Elena and Dave. I don't want to cut you guys off if you have any more comments.
That's all right. If there's other questions, happy to address them.
I think that's actually all the questions that we have from the audience. So that's probably a perfect time to wrap up then. So thank you all so much, the three of you, especially for the second half of the program. That was fantastic. And Dan and Holly, thank you both for joining us. Brian, always for providing wonderful comments, and thank you for the kudos. We couldn't do this without all of you supporting us. And so from us, again, just thank you so much. Outstanding content. So well done, everyone.
Thank you for having
Great.
me.
Thanks so much for having us.
I look forward to seeing you all again soon at another program, and have a great rest of your day.
Thank you,
Bye-bye.
Rachel.